Hi. Hello, hello. Thanks for joining. Thanks for watching this video. Uh, Today I'm going to be talking with you about how to pass the NCLEX before April 2023, right? So how are you going to pass your exam before April 2023? Hi. Hello, hello. I can see you. Thanks for coming on in. I can see you. Hold on one second. I'm live here on Instagram and on Facebook. Okay, there we go. Oh, good. Okay. Okay. Hello, hello. Hello from Nepal. Good to see you. Let me know where you're tuning in from. Comment below what city, state, or country you're based in. Good to see you. Happy post Thanksgiving for those that are in the US. Hope you had a great Thanksgiving. Hopefully you were able to eat pretty good. Did you eat good? Did you enjoy your Thanksgiving? If you did, like or comment below. Yes, I did. Hello from New York. Good to see you. Welcome. Thanks for coming on in. Thanks for coming on in. Hello from Louisiana. Hi. God bless you. Good to see you. Good morning. Thanks for coming in. Good, good, good. Welcome. Well, I want to do a live broadcast today. And I'm going to be talking with you about how to pass the NCLEX before April 2023. So if you have graduated if you're going to graduate in May, then this is probably not going to be very relevant for you. Hello from Nigeria, welcome, because then you're going to have to take the next gen NCLEX. But if you are one of the common people that follow me, which are those of you who are trying to pass the test and you took it a few times or one time, and I've been talking lately about what's going to be on the exam, then you really want to stay tuned. You really want to prioritize this. You're still trying to get your documentation. Okay. You really want to prioritize taking the test now the before the April. Like if you graduate from school at least a year or longer, then you really want to prioritize taking the exam as soon as possible. Okay. It depends. It depends as far as like how long it takes. Okay. It varies from state to state. Some states it takes about 3 months. Some of them 45 days. Some 30 days. Some a year. I don't know exactly for New York, to be honest. Okay, so I want to talk with you about, hello from Brazil. I want to talk to you about how you're going to pass your test. So let me go ahead and share this really quickly. If you're watching this, thanks for watching, and thanks for commenting below as well. So let me ask you a question. How many of you are trying to take the NCLEX before April 2023? If so, say yes, that's me in the comments. Yes, that's me. If you're trying to take your test before April 2023, put yes in the comments. All right. And then or put yes or put 1 if you're trying to take it before April 2023. And then if you're going to take it after 2023, so meaning that you're actually going to take the next gen NCLEX, then put no or 2. All right. So 1 if you're taking it if you're trying to take it before the test changes, and then 2 if you are taking the test once it changes. All right, so far I see yes. Okay. All right. Okay. I'm trying to share this too at the same time. Okay, it looks like everybody is trying to take it now. And if you watch this on the replay, just tell me on the replay too. Like I said, 1 is for, yeah, I'm trying to take the test, before NCLEX, before the, what do you call it? For the NCLEX, the next NCLEX. And then 2 is for, no, I have to take it in April because I'm graduating in April. So I'd love to hear what your opinion is. All right, so But it looks like mainly I got people that are trying to take it before then. So this is going to be perfect for you. Okay, it's going to be perfect for you. So let's kind of go right into it. And let me just do some quick updates as well. So if you're watching this video right now, we are doing like a Black Friday promotion. So pretty much you can get our books, any of our books, you can order it today. Let me show you one of them right here. This is our infamous guide. This is our 70 diseases and conditions and cheat sheet guide. So this is the physical copy. It's a really, really big book. I know the lighting is kind of hard to see, but it's a really, really big book. It has like questions, it has content review, farm tables, just different type of information. And then we also have this one right here. This one is even bigger actually. This is our 11 body systems notebook. This is all about anatomy and physiology. And then we also have our farm book. I don't have that in front of me. And then we also have our EKG book. So if you want to learn more about that, just simply visit the link in the bio. Okay, so let's talk about how to pass the NCLEX before April 2023. So the first one, number one, is you need to get a baseline, all right? You need to get a baseline. All right, excuse me. So you need to get a baseline. So what do I mean by this? So I know for some of you that are trying to pass your test, you don't have a recent baseline. So if you took the test recently, like if you took your exam within the past maybe like couple months, then you probably have a pretty good baseline because you took the test. If you didn't pass it and you got your results in the mail, it's going to tell you, mail or email, it's going to tell you what areas you scored low in or weak in. But if not, if it's been, longer than 2 months since you took in the test, then you need to know where you stand today. So you have to have an accurate idea of where you are right now, because if you try to prepare for the test without knowing where you stand, then you're going to have problems with just determining if you're ready or not, right? So one of the biggest issues for a lot of students is that they're not certain if they're ready or not. Like they'll do some work, meaning that, and usually work is, doing lots of practice questions, watching videos on YouTube, right? That type of stuff. And then maybe getting some video trainings as well, right? So a lot of students, that's what they essentially do. But the issue though is that you did not really create a very accurate baseline. And so it's kind of like with nursing. When we have a new patient, we don't just start treating them right away, right? What do? We always get a baseline. We always figure out, okay, where are they at right now? What are their current vital signs? What were they like before they got to the hospital? We tend to do what? We assess the patient to see where they are at right now. So this is one of the first things, is that you need to know what your baseline is. You need to know, for example, okay, what are the areas that you're weak in, right? Why are you weak in those areas? Meaning that, okay, you could know you're weak in pharmacology, but why are you weak in pharmacology? What are you struggling with exactly? Is it not knowing the side effects? Is it not knowing all the medications or how to know the medications? Is it struggling with the medication administration, right? So being more specific as far as like why you're struggling with the test is really important. Knowing those weaknesses, knowing your weak areas, understanding the way that you think. So for a lot of students, you're not really clear on the way that you think. So meaning that you may understand, okay, you may see something, but you may not be able to articulate what you want to say, right? So for example, if let's say I ask you a question and right now I put you on the spot and I say, okay, tell me what you know about COPD, for example, and you're able to say, okay, it's like a respiratory problem, something has to do with the lungs, but you have a problem with fully articulating why they're having that problem, what their signs and symptoms are, what is the appropriate treatment? You see what I mean? What is the nursing interventions? How is COPD different than bronchitis, than asthma, than other respiratory issues? So for a lot of students is that you you have a general understanding, but you don't have a full detailed grasp on like what the missing piece is and why there's a missing piece. Like why is it that I'm struggling with remembering X, Y, and Z? Why is it that I like I can read it or I think I read it and then I forget what I just literally just read? Why is that, right? And I talk about this oftentimes, but for a lot of students, it's because they don't have the right foundation set up, right? So for example, the foundation is weak, like you don't understand or you're not aware of pathophysiology. When you've been out of school for a while, one of the areas that you're going to naturally be weak in is anatomy and physiology. It's an area that you're going to forget because it's just normal to, because a lot of people don't look at microbiology every day, right? Who studies microbiology just because they want to? Who studies anatomy and physiology just because they want to, right? It's just not the case for a lot of people. So this is one of the things is that like you have to kind of like stop and like evaluate, okay, why am I struggling with X, Y, and Z? What is it that I need to focus on moving forward so that I can be successful, right? So that's one of the first things is that you need to get a baseline. You need to figure out what it is, what are your specific weak areas when it comes to the NCLEX. Is it also, are your weaknesses also like a fundamental disorder, right? So for example, a lot of the students that I work with or that go through our courses, some of them discover that they actually have a learning disorder. Like they didn't realize that they had a learning disability until they went through the course and realized, oh my goodness, wow, I really have ADHD. And it's important to know that because for a lot of people, it's something that you probably you've lived with all your life, but you didn't know that it was not normal, until somebody showed you the picture, until somebody showed you, the difference, And so then once you know that information, then what? Now you can go to the NCSBN and you could tell them, hey, I have this learning disability, and then now they can give you testing accommodations with which positions you to pass your exam. So that's what I've had for a lot of students is that sometimes we just honestly assessed that they had learning disabilities that they didn't realize, and then we gave them resources specific to those learning disabilities. We gave them recommendations specific to those learning disabilities, etc. So that's one of the things as well, is realizing that too. Okay, all right, so the next one, number 2, is that you need to create an organized plan, right? You need to create an organized plan. So for a lot of people, you don't have a plan, right? Your plan is to do a bunch of questions, right? Your plan is to watch videos or read this book, right? Or, it's not really like a very specific plan, right? What to do for NCSBN question. Can you repeat that again? I'm not sure what you're trying to say. So you don't have really a very specific or tailored plan to you, right? So what a plan looks like is you set a date as far as when you're going to take the NCLEX, and then you work backwards, right? So for example, okay, let's say you're going to take your test by end of January or end of February, right? Or you're taking it, this month or something. Then you would say, okay, now that you have the date, now you have to work backwards, and now you can start planning out, okay, week 1, I'm going to focus on farm. Week 2, I'm going to focus on diseases and etc. Right? And then I'm going to do assessment tests and practice questions based on what I learned to reinforce what I studied. Right? So you have some type of clear plan in motion. And what a plan also does, it helps you to know if you're improving or not. It gives you more motivation. How many of you start studying and then you lose motivation? You get tired, weary, life happens, which is normal. But sometimes the issue though is that you don't have a very set plan to help keep you focused and consistent. So that's why you also need like a plan as well, because a plan is going to help you to know if you're on the right track. A plan is going to help you to be more consistent. And then a plan is going to keep you like, consistent until you take your test. Okay, so that's number 2, is that you want to have a plan. All right, create an organized plan. Number 3 is, now this part I know for a lot of people, they kind of struggle with. So one of the things is that you need to, I recommend that you study at least 10 hours per week. All right, so this kind of depends on a lot of things. So it depends on your background. It depends on when you graduate from nursing school. It depends on your learning curve, right? So if you have a fast or slow learning curve. It also depends on like how much you currently know right now. So for some people, you could get away with studying less, but for a lot of people, you actually need to study a lot more. Yes, it's changing in April. Yes. Oh, yes. I didn't know. Okay, yeah, you didn't know that. Yeah, it's changing in April. All right. So that's one of the things too, is that you have to. I recommend that you study at least 10 hours per week, so that way you can really you can give yourself adequate time. So the thing about nursing is that nursing is very detailed. It's a very detailed topic or subject. Um, for me, when I went through nursing school, it was 5.5 year. It was a 5.5 year program. Oh, you thought it was January? Yeah, April. So it was a 5.5 year program. Okay, so that was the norm, and I know now today people are getting their RN in like 2 years or 3 years or something, and that's a lot. That's a lot, and it's even more when you have been out of school for a certain period of time, like at least a year or longer, and you're trying to pass the exam now. So now you have to give yourself adequate time to comprehend and learn the material, right? So I remember when I was in nursing school, one semester was typically about 3 to 4 months just to learn pharmacology. You know, just to learn pathophysiology was 3 to 4 months. And so the issue is that for a lot of you, you're trying to cram, so much information in so little time, and you're not giving yourself enough time per week to study. So that's one thing I see for a lot of students, is that like you haven't really created enough time in your schedule to study in order to increase the likelihood of you getting results. And so then you get so discouraged if you don't pass your test, when in reality you didn't give yourself enough time during the week. And I know that it can be hard because you have other responsibilities, but the thing you have to think about is that if you have other responsibilities, then you have to stretch out your test date. So if you have less time to study during the week, then your exam date needs to be farther out. And obviously, ideally, you need to make it so it's not too far out because the test is about to change, right, in April 2023. So this is one of the things, is that the issue for the thing I know for some people is that you're comfortable right now. You're comfortable, right? Meaning that your mindset is, well, you know what? Oh, April 2023. Oh, that's away from now. Oh, I got plenty of time, right? So you didn't study this week, right? You're not really gonna study during the holidays, right? You're about to chillax, right? Enjoy your loved ones, right? You're not really gonna take the time to really study. And when I say study, I mean not just doing practice questions. It's not studying. Doing practice questions and studying is not the same thing, right? So studying is like you reading, taking notes, learning, comprehending. That's studying, right? Doing practice questions at your leisure is just doing practice questions. So it really has to be more concentrated study. So for a lot of people right now, you're too comfortable. You're too comfortable because you think that you have plenty of time because it's April, right, of 2023, but honestly, you have only 4 months. And you have to keep in mind, like I mentioned before, that there's a wide variety of detailed information you need to know, right, to pass your exam. There's a lot of content review you need to understand, as well as do practice questions. So that's why you have to prioritize the studying now. Like, it's not like, oh, let me wait till January. If you wait till January, you're gonna have so much pressure to study and pass your exam. And here's the other thing, you're assuming that you're gonna get a test date on time before April 2023. Right? So right now, for example, I'm tutoring. I have students that I'm tutoring privately, and I'm telling them, no, start getting the test date as soon as possible, because what's going to happen is that next year's going to get here, and everybody's going to rush to try and take their test before April 2023, and there's not going to be enough test dates. There's not going to be enough test dates. They're not. It's going to be slim pickings, okay? And so you're going to find yourself in a position where you're going to be forced to take April tests, even though you've been preparing like you're taking it before then. So that's one thing you have to really honestly like consider as well. And that's something that a lot of people are not thinking about right now. Okay, so that's number 3. Number 4 is that you need to focus on understanding concepts. Okay, focus on understanding concepts. So one of the things about the exam is that, and about nursing period, is nursing is all about comprehension. It's not something where you can read. I'm sorry, let me put it like this. It's not something that you can memorize and then take the test, right? I remember all the way up until I started nursing school, I literally had like a photographic memory. I still do, but I had a photographic memory, and all I did honestly was just memorize. I memorized it. I studied it very well. I memorized it, and boom, A plus, A minus, every time I would take a test, because that's all because as long as I put the time to memorize, I would do well on my exams. But it wasn't until I got into nursing school where I realized that wasn't enough. It wasn't enough at all. Because now it wasn't about memorization, it was about comprehension. It was about being able to connect the dots. It was about being able to understand abstract thoughts, abstract concepts. That's what it was about. So that's one of the things, is that when it comes to the NCLEX as well, like you have to think more critically, and you have to understand concepts. So like, for example, like if I'm talking to you, let's say I'm telling you, okay, what the heart does, right? You can't just memorize what the heart does. You have to understand why it works the way it works. You have to understand that it's a pumping organ. You have to understand how blood flows and why it flows in that direction. You have to understand that it's deoxygenated blood that comes in and oxygenated blood that goes out. You have to understand what pulmonary circulation is. And then once you grasp all of those things, then you'll understand the difference between left-sided versus right-sided heart failure, right? Then it will all make more sense to you. Then you'll understand like why they have those symptoms for one versus the other. So nursing is all about concepts. So if you are not passing your exam and you took it over and over again and you keep failing and you're getting the minimum question, your issue, and you've been studying, and you have been studying, your issue is not the time that you're putting in to read and study facts. Your issue is not doing a bunch of questions. Your issue is concept. Like you need aha moments. You need more, oh, that's the bigger picture, right? That's what you essentially need. You need to see how everything works together, not where you're studying everything separately. So that's one of the biggest things for a lot of students too, is concepts. And concept is something that ideally you need to be taught. It's not something where you should be self-taught. It's hard to teach that, to realize that on your own. You honestly need you need somebody to teach it to you. Okay? So that's number 4. All right, hope you find this helpful, okay? Number 5 is you need to also learn multiple strategies. You need to learn multiple strategies and write them down and memorize them and understand them. So for a lot of students, what your strategy is doing lots of practice questions. And that's not a strategy. That's just doing lots of practice questions. There's nothing wrong with that because if you have the right foundation, doing questions will help to improve your critical thinking skills. But if you don't understand strategy, you're going to have to keep doing practice questions. You're not going to understand why it was this over this with different types of questions, right? So a strategy is like, for example, the ABC rule. A strategy is like, how do you answer priority questions? A strategy is, how do you answer static questions? That's a strategy, right? So if you can learn and memorize a lot of strategies, you're on top of the content review, your chances of passing is higher, much higher. So you have to also prioritize learning, and I would say at least 20 or more strategies for how to learn the content, how to study, how to understand farm, how to answer farm questions, how to pick the answer if you don't know the drug. This is what I'm talking about, right? So learning multiple strategies is so critical towards having real success when it comes to the test. Okay, and then number 6, all right, 666 is to create a balance between content and questions. Content and questions. Content and questions. Content and questions. Once again, I'm talking to those of you who have been out of school for at least a year plus. So the issue for a lot of people that's in that category, right? Your approach is imbalance. So meaning that it's either all or nothing. That's what I noticed with a lot of people, the mistake that they make. You either do a lot of questions or you do a lot of content, right? And then you'll take the test and then like, wait, how come I didn't pass? Or how come I did worse this time? Or, so like and so the issue is that it's not balanced, right? Your approach isn't balanced. So you need a variation of the two. And then you need a content review plus questions because the content is going to help you to create the foundation and help you to comprehend things faster. And the questions is going to be like the cement that helps to like put the glue together so that way you can think more critically and that way you can pick the answers faster. So if it takes you a long time, and when I say a long time, I mean on average at least 2 minutes to answer most practice questions, it means that you're struggling with content review, right? And so that means you essentially honestly need to prioritize learning the content and then also doing questions. So oftentimes I'll tell my students, okay, you're gonna do this, this, and this, and this, and then the last 3 weeks do a lot more questions. That way you have a balance of everything. So these are some of the essential things that you can do that will help position you. Keyword is position you. Position you to pass your NCLEX before April 2023. I really, really want to see you succeed now. I just got a student that just told me that she passed her NCLEX or RN exam and from attending one of our classes, and I was so happy for her, because now that is off of her shoulder. Now she doesn't have to worry about the next gen. She doesn't have to worry about, how she's gonna take that test. Like now she's good, right? She's fine now, So I really want you to take it very seriously about passing your exam today before it's too late, as soon as possible, before April 2023. Do not wait because the test is going to be very intense, especially if you've been out of school for at least a year or longer. Okay? One of the things I would also recommend as well, for those that listen to this, and you can go to the link in the bio afterwards, is I do have an assessment program. So the assessment program is all about teaching you what I just went over right now, right? So the issue for a lot of students is that you don't know how to approach different topics on the test correctly. Okay, how do I learn from? How do I understand the diseases? How do I memorize the diseases? How do I do priority questions and etc.? So the issue for a lot of students is that you don't have the right approach, and that's why you're getting the same results, you know. And so one of the things I do in the assessment program is that I give you the format. I give you the blueprint first, meaning that I show you step by step, here's the best way to understand different topics on the exam, and then I help you to understand them. Like, I help you to actually learn them. There's actually one training in the program that's called The Secret to Understand the Content. I've gotten so many amazing feedback on that, just that one video out of multiple videos, out of multiple trainings and information in the program, where I teach about how to truly grasp the content, especially if you feel like you don't know it at all. So with the bundle, not only do I go over like how to learn the content, but I help you to better understand different concepts. You also get the body systems crash course, which is essentially the anatomy and physiology program that we have that teaches you patho quickly. And then also I go over what are the basics to preparing for the NCLEX after being out of school for at least a year or longer. And then in addition to that as well, I also go over cardiac disorders, diseases, different disease processes. So it's essentially a good format for students that have been out of school for a while but are struggling to pass their exam. So if you want to learn more about it, you can click the link in the bio, or for those of you that are watching this on here, right, on the live video on here, just click on the comment, not on Instagram, but click on here on the comment. But on Instagram, just go to the link in the bio afterwards, and you can learn more about it there, all right? And it's pretty much our assessment program bundle. And like I said, I've had people actually that's passed their exam just from this course by itself. So if you want to learn more, you can visit the link as well. And then if you want to get our books, like I mentioned, our books right here, this one, we have multiple other ones. We're having a Black Friday special where you can learn more through the link as well. All right, I'm still taking prerequisites, and then I will start the core, but almost there. I need to keep your eye on the prize, okay? Don't give up. Keep going. All right, you guys, thank you for watching this, and I'll see you guys the next time.